Hello and welcome to the Brandon Macco podcast. So with me today, Dr. Chelsea Pierotti, and she has a PhD in sports psychology, and she was a professional ballet dancer in the 2000s. And well, she's a professional sports psychologist now. And how? So for maybe first, thank you for joining me today.
Well, hi. Thank you for having me.
And how did you decide to go, from being a dancer into psychology, and as I understand it, sports psychology and helping other dancers? How did that sort of progression go for you?
Sure. It progressed kind of in a parallel fashion at first for a long time, where I pursued dance and I loved the art of ballet and I loved that pursuit. But at the same time, I was in college pursuing psychology. I thought I was going to go more traditional kind of clinical psychology
Mm,
route. I didn't think there was a crossover. I thought I
mm,
have these two loves. I can't let go of either one. So I will just work insane hours and do both. And so I did both for a long time and then realized I didn't fit as well in the traditional kind of clinical psychology side. I found the broader field of what's called positive psychology. And that just
mm,
resonated so
mm-hmm,
much with me,
mm-hmm,
which, that sense of it's for everybody and just helping everyone
mm-hmm,
be the
mm-hmm.
best versions of themselves, right? How to not just be okay, but thrive. And so once I realized that that was a field, I was immediately drawn to it, knew that that was the plan. And then, personal circumstances meant that I didn't want to move out of my home state to go to grad school. So I looked around where I lived to try to find a good program. They had a sports psychology program, and then it all clicked. I was like, that is what I'm supposed to do. And it was an amazing moment because I think a lot of us spend our teenage years well into our 20s and 30s even saying, I don't know what the heck I want to do with my life. How does
Yeah.
this fit? And it was a big aha moment that that
Mm-hmm.
was right. And so once I started pursuing it academically, it was a natural extension to make sure that my work focused on dancers. There's not a lot of people who do it within the arts. So it's great to give back to that community that I love so much.
And you touched on sort of positive psychology, and there's a book I often recommend to people, Psycho-Cybernetics, and I feel like that is sort of the origin book, and I know it was used by a lot of high performance athletes or the coaches of high performance athletes,
Yeah.
and then it sort of trickled into psychology. It trickled, and he was a plastic surgeon.
Oh, interesting. Okay. I didn't know that. Yeah.
He was a plastic surgeon, and so his book then trickled into psychology.
hmm Which I love when that happens, when you have the cross between sciences. I think you have so many, like it's things apply outside of our own field. It's great when we can see that
Mm-hmm.
that expansion. Yeah.
And it feels like when someone discovers positive psychology or sort of the tenets of cognitive behavioral therapy, and if it clicks for them, or the concept of the self-image, they're like, why is this like taught in school? Like this seems
Yes.
so monumentally important to succeeding in
hmm
life and being happy in life. Why isn't
Yeah.
that taught in school?
I know. I wish some of it is trickling into school, which is great. My first grader said something about the amygdala to me the other day, which is the part of the brain that processes emotion.
Yeah.
So somewhere in school, she heard that word. But my challenge though, too, is I think as it's becoming more and more accessible, it's getting skewed. So,
Mm.
you take things like growth mindset, which is now pretty pervasive in a lot of schools and it's, taught in a lot of sports and education settings. But like the original science of what it is has gotten bent and skewed
Mm.
when it's almost like this game of telephone, right? Where so many people
Mm-hmm.
start adapting it and changing it, and then it's like not really what it was anymore. So it's that double edged sort of like, yes, I want this to be taught everywhere and to be, everyone should have access to this and see it, but have access to the right stuff and have access to things that are still rooted in science.
Yes, very, very, very true. Oh, the internet just
hmm
think, for example, red light therapy.
hmm
Red light therapy, if you ask the internet, it fixes everything. Absolutely, no matter what it is, red lights, shine some red lights on it, we'll fix that right up.
hmm
But that's taking the, and actually, I will say that the people who make the lights, so sell it to doctors in such a way, oh, buy this machine, it'll cure everybody. So some of the doctors
hmm
think it will, they just spent $20,000 on a fancy machine. they've been
They want it to
convinced,
work.
they've been convinced it fixes everything too. So maybe even the doctors are convinced it fixes everything. But if you actually look at the research and the evidence, um, red light therapy works on a very few number of conditions where there's actually results. And when
Hmm.
it does have results, the results tend to be fairly minor.
Yeah. And the same thing's true of cold plunge, right? Where
Yeah,
that
yeah.
is so powerful. And it's like, look at the science. It's not what you think it is. But it happens in sports psychology a lot too. So there's things like, affirmations or gratitude
Hmm.
journals that are on like every influencer in social media talking about their gratitude journal. And there is some great evidence behind things like that. But it becomes this idea of, oh, if I just like say an affirmation in the mirror every morning, I'll be great. I will be happy forever. And it's like we're missing, it's like it's one piece of a
Yeah,
larger puzzle.
that's
Yeah.
it. It's one piece of a treatment plan that a psychologist could put in,
Hmm.
right?
Yeah. It can
Um,
be very effective, and then people give up on it so quickly. They're like, oh, well, that didn't help. I'm like, well, no, of course it didn't. That's not how any kind of treatment in any field usually works.
so I wonder if you've heard of lifestyle medicine.
I think, well, I'm not sure. I feel like maybe that's a synonym for something. Tell me more what you're
So
thinking.
lifestyle medicine is a medical specialty or a medical discipline. It's a board, the American College of Lifestyle Medicine or the
Oh, okay.
American Board of Lifestyle Medicine. There's an international board. There's a board in Malaysia. There's a board in Singapore. There's a board in the UK. And actually,
Okay.
they're all sister organizations to each other. It's sort of a movement in healthcare, particularly focused on medical doctors, because medical doctors often don't receive any training on nutrition, for example,
Hmm.
or
Yeah.
positive psychology.
Right.
Words can harm and words can heal. I have a particular interest in chronic pain, and if you and they've found that actually particularly chiropractors are bad for this, but so are medical
Mhm.
doctors being like, yeah, okay, like see on the x-ray that must be your source of pain. Oh yeah, so every time you're moving things are just grinding together. Just telling
Mhm.
that to someone who has no pain, even if
Right.
you take someone else's x-ray and you convince them that something's going to grind together and
That's
they'll start
there.
feeling pain. You can convince them to feel pain.
Right. Okay. Yes. I know.
Yeah.
Okay. I'm with
So
you.
so anyway, they don't receive any sort of counseling or coaching training on how to coach. They don't
Hmm.
receive or hear about the evidence for diet. It's just drugs, or exercise,
Yeah.
for example. So it's a very easy specialty or certification for a medical doctor to get, and it's interdisciplinary. So there's nutritionists, chiropractors, naturopaths who are allowed to participate in it. But I like it because it's finally getting things like positive psychology um, into the hands of doctors. Um, and also nutrition and exercise and those
Yeah.
things, evidence based.
Yes. Oh, that sounds wonderful. I was
Yeah.
thinking of something slightly different within psychology, but that the idea to bring it's that interdisciplinary. I think that
Hmm.
again just helps helps every field. But being able to know how to deliver your knowledge
Hmm.
matters, right?
Hmm.
Like in you may how you can express it, share it, communicate it makes a big difference in how it's received. And that I think that's all. That sounds wonderful. I would love if my doctors all had that certification and understood this field.
Yeah, the only problem, and in fact, there's a seminar. I got an email today. There's a seminar later this week. How to make money.
Oh, right. Yep. Well, there's that too. And that
Because
it's yeah, it's both.
yeah, it takes a lot more time to do that, and often you can't be reimbursed by insurance to spend more time talking to patients and asking
Right.
them, how is he eating? How are drugs? Like, are you on any
Hmm.
drugs? Do you have any friends still? Like positive social connections, like
Yeah.
all sort of important questions and evidence-based
Hmm.
questions.
Yeah.
Um, and
Well, and I don't know if this is true, but I feel like it's better in pediatrics, or there's just more awareness and conversation in like and it's also more common in the US for kids to have like those well visits every year. And they
that's true.
ask those psychosocial questions.
Yeah.
They ask, do you feel safe at home? Like they ask so many of those questions. And then as we get into adulthood, We don't do the well visits very much. People are bad at that.
Mhm.
And then, when we do, yeah, that's not those kinds of questions anymore. It's like the blood panel, everything looks good. Okay, moving on.
Yeah.
And not digging into what's actually happening. Yeah. Or how you're really feeling
Hmm.
emotionally as well as physically. Yeah. They're all tied.
Hmm. Maybe we'll go back to dance and sports because I haven't
Sure.
had anyone. I don't think I've had counselors and psychiatrists on before, but and psychologists on before, but I've never had a sports psychologist on
Yeah.
before. And the link between mindset and performance. Could you speak to that a little bit?
Sure. Of course, I believe it's a very strong link. That's why I love to teach it with athletes. So, uh, the link is that it's a constant back and forth, right? Your brain is controlling your muscles, but your brain is also receiving feedback from your muscles in your environment. And so that and your joints and the neuroreceptors in your joints, like the information in your body is going back and forth. And so being able to take some intentional control over your mindset can be kind of the shift people are looking for, can be that secret weapon for elite athletes, and not just elite athletes. I would use it with kids too. But being able to, and I say intentional control, because I think a lot of people are like, oh, well, I'm just an anxious person, or like, oh, well, I always just think, I always just get nervous before the game starts, but that's just how I am. And it's like that might be true. Like you might have, either clinical anxiety or just be a naturally more anxious person, but that doesn't mean you can't intentionally work on your mindset and your reaction to your environment and, kind of controlling the things that are in your control. So
Hmm.
it's, yeah, being able to harness that power and not just like let it be the way it is for you and follow the train.
Yeah, because it's like a self-fulfilling prophecy. In fact, if you didn't get anxious, you'd be like, something's wrong with me. What's going on? So,
Right.
so your brain
Yeah.
is
And
going to
it's
be
just,
anxious too, because that's your
yeah,
expectation.
absolutely. And it's knowing that some level of that is normal. I think a lot of athletes were
Mm.
like, oh, how do I be perfectly calm before this game starts? Or how do I have to make sure, that, I am in perfect control and I'm not nervous at all. It's like usually being not nervous at all isn't the goal. Like some level of anxiety is good. And same with stress. Some level of stress is good. And so being able to see it's that cognitive reappraisal being that word that we would use in psychology,
Mm.
but thinking about it differently and just thinking about like, okay, I have butterflies in my stomach. I'm excited. Like, let's do this. And just interpreting it differently. Because as you know well, right? Like that physiology in your body of when you're nervous, right? If your hands are shaking, you're sweating, or the butterflies in your stomach, that is just your body getting ready to do something that's maybe a little scary, right? It's like your body does the same thing when you're going to ask somebody out, when you're going to go on a roller coaster, when you're going to it's the same thing. And so it's just how you interpret it. And if you decide that this is exciting and I'm ready,
Hmm.
then it's going to help and facilitate your performance.
Hmm. I've also heard that, although you do have to put in the time and work, but there was a study of people sitting down and visualizing exercise or an activity.
Uh-huh.
And then there was a group who were actually doing the activity, and then a group who were just saying they were doing nothing. And the group who thought about doing the activity performed almost as well as the people who actually practiced.
Yes, there's so much evidence to the power of visualization, which is amazing. And it is that, like what we know in the neuroscience, the part of your brain that is like activated or lights up when you
Hmm.
are doing a physical activity is the same part of your brain that lights up when you visualize it. That same neural connective pathway is being activated. And so it does improve. It can facilitate practice. Now, the research that you have, like some people who visualize, some people who do the exercise, and the people who do both, of course, the people who do both end up on top, right? The ones, visualization is not going to teach you a skill you can't already do, right? I'm not going to visualize my way to the NBA. Like you have to do the work, the physical work.
Hmm.
But if it is a skill that you know how to do and you're trying to get the automaticity in the practice, visualization can be incredible. And that putting the two together, yeah, makes such a difference for people. And then visualization goes beyond the physical skill. Visualization can be very powerful for calming your body down when you're anxious, visualizing yourself in, your favorite calm place. It can be wonderful for motivation, like picturing what, it's the end of the event and you dip your head forward to have the medal around your neck, like visualizing this end result to be like, okay, I got to go put the work in today because that's what I'm doing this for. So there's so many avenues to use it, but yeah, it's a very, very powerful mental skill.
Mm-hmm. I think it's understated how powerful it can be.
Yeah.
I don't know if this is because maybe I'm more in tune with my body. I did gymnastics and acrobatics.
Okay. Yeah.
And it is true that if I were to do, let's say, pull-ups, or if I just, I can work out with no weights and I can be extremely sore tomorrow.
Mm-hmm. Yes.
When you put in really intention into it, you're imagining all of that weight, and even I don't even have to pull that far. Right there, I can feel every muscle fiber firing. I'm sweating now.
Right. Yeah, absolutely. It's that muscle activation still happening.
And so some people use this as an excuse to work out. Oh, I can't work out. I don't have weights. I need machines. I need to go to the gym.
Right. I think, gymnastics and ballet will tell you, like body weight's enough.
Oh, for sure. And imagination, you can activate all of the muscles and get a really good workout through intention.
Yeah. Yeah. Oh, intention can be powerful in a lot of ways. And I think I talk to a lot of athletes about intention when you go into practice, because you can get very just like in a rut, right? Like I show up, I do the same drills, I do the same thing with exercising. I do the same routine. I do the same set of, same rotation, and you get bored and you check out, and you're not going to get nearly the same form of practice without setting that intention at the beginning of what you want to get out of it. What are you focused on? That's another good mental skill, just that set of intention. Yeah.
So although I touch on a lot of topics and I have a lot of letters behind my name, but I'm particularly interested in chronic pain. I work with people with chronic pain. Yeah. And the route out of chronic pain tends to be, well, you work out scar tissue, fascial adhesions, but it's neuromuscular reeducation. That is the route out. And a lot of people plateau because the physiotherapist just focuses on pure strength of they just need to do more squats. They're still not better. Okay, just more squats, more squats, more squats. It's been 2 years, more squats, more squats. But it's control, and you focus on, you find weaknesses in control and functional ability, and you strengthen those. But it's mentally fatiguing. And if you've checked out, there's no sense in doing the exercises.
Right. Yep.
Because you're trying to train the brain, and you have to demand perfection of yourself or aim for perfection, and you have to be frustrated because that triggers learning and triggers the whole process.
Yeah, it is. The intention is everything. And my husband actually had a bad accident that meant he had to essentially relearn how to walk for a while, and the intention that was required, I think, surprised him, and it was. He was able to work through it. But yeah, it's like you can't just, like, the muscles aren't doing what they're supposed to be doing anymore. They're not talking to each other or to your brain the way that they were before. So yeah, it's that neuromuscular education of like, how do we gain that intentional control again? And it is hard, especially for an adult who's like, I should know how to do this. Like, what is wrong? And it's like, yeah, nope, that's how the brain works. We have to relearn it. And you can, but it's going to be hard.
And I think that's important for people listening here, because a lot of people are just like, I can't do that. I can't do that. I can't do that. And if they don't hear it from us experts, that yes, it's hard work. And maybe today, I was working with someone who couldn't move her toes the other day. And by the end of the session, got the tiniest twitch. I was like, yes!
Yes, absolutely. That littlest bit. Well, and that's the growth mindset I was talking about, and what that plays into this, like whether it's injury, chronic pain, that growth mindset is just the idea that, like, I can get there with time and effort. Like it might take months, years, but I can do this. And rather than having that ceiling of like, well, it's just, this is too hard, this is too much, and I give up. And that is where that mindset plays in. Like, if you're approaching something that is very challenging, your mental approach to that challenge is indicative of whether or not you're going to be successful.
Well, I think it also helps to hear that it's possible. If you have the mindset, okay, I'm going to fly. Okay, come on. fly, fly, fly.
Right. Yeah. And it's like, that's kind of what I was alluding to before, that like visualization, like it has to be physically possible. Right. But at the same time, it might be physically possible way down the road from where you are right now. And same for athletes who are maybe just, the middle school athlete that wants to be a professional someday. I'm like, your dream is possible. It's just a really long way down the road. And what can you do today to make small progress to get your toe to twitch? What's that small progress today that will get you down that longer towards those bigger goals? Yeah.
Oh man, I'm already feeling motivated. I can't wait to become a professional dancer. I'm
Yes. That is a long road, but so worth it.
Now, I'd like to, and I think that we can transition to this smoothly, talk about resilience.
Yeah.
Because
Absolutely.
there's resilience in pursuing your goal, and then there's of course resilience after the big injury or the poor performance, or
Mm-hmm.
maybe changing the mindset of someone who's getting older and just turned 40 and can't do a backflip anymore. And
Yes, I'm with you. Aging is a whole other area. Yes, of resilience. So when I talk with athletes about resilience, it's in one of two areas. There's resilience in like the immediate moment. I just made a major mistake and I have to let it go and keep going in this game. Excuse
mm,
me, keep going in the game. Or for a performing artist, you a dancer who falls on stage, or like something happens on stage, but you have to let it go and keep going,
mhm,
right? A gymnast falls off the beam, you have to get back up and keep going. There is no time to like go through this whole reset. So there's that resilience of coming back in the immediate moment. And then there's the resilience that's more the long term. That's more, how do I care for myself to prevent burnout? How do you be able to handle the bigger struggles, being able to care for yourself and know it's really emotion management. And maybe that's because I'm working with a lot of teenagers. I think that's on my mind a lot,
mhm.
that resilience is really about managing emotions and not trying to uh, stuff them down or pretend like everything's okay. So I think again, the social media versions of resilience of just like, be positive, be happy, just being positive all the time. I'm like, that's toxic positivity when you ignore that there really is a challenge.
Hmm. Hmm.
So knowing that like, no, there really is, like, I really am upset, and learning how to say like, okay, I'm upset. What is that emotion? Am I angry? Am I disappointed? Am I jealous of somebody? Am I like, what is this emotion? And being able to label it and understand it, and then having an intention of how to cope with it. And I think that resilience comes from not making negative emotions stop, because that's not the human experience. We will have them, but learning how to cope with those negative emotions and process them to be able to come back and, go back to work the next day, to come back into, go back to the gym and make it happen. So I usually see it in those two ways, either that immediate moment or the longer ability to manage the more challenging emotions and not let that stop your path.
So I recently, was it just last week, talked to someone who was promoting MDMA assisted counseling.
Oh, wow. Okay.
So Molly, or well, not just MDMA, which is Molly, but also psilocybin. She had used psilocybin.
So, yeah, psilocybin I've heard more about, and
Yeah,
ketamine. Yeah.
yeah. Ketamine is the big one in studies in the
Mm-hmm.
states. LSD is another
Mm-hmm.
one that people are trying to do research again on. It allowed her to just speak more freely, just
Mm-hmm.
be more, um, just being able to approach things that she was more defensive about, and didn't, even though she was trying to be open with the counselor, like
Mm-hmm.
she felt like she was not able to in a way,
Yeah. And
and
it's not a lot of the work that I will say I'm super familiar with,
mm,
but I have heard similar approaches or similar experiences from people that having, again, under supervision and under
yeah,
care of knowing how much you're taking, being able to basically get out of your own way and,
yeah,
yeah, be able to put down the guards a little bit and share more openly. Yeah.
and work through. In her case, it was working through trauma, and
Mm-hmm.
she said exactly what you said. And of course, she since she promotes this sort of professionally, she has all the research and is up to date with it all, but it's very, very dose dependent, and you have to be careful how you dose because everyone's different. And
Yeah.
also, we're talking about now. She's looking forward to when it's going to be outside of trials, because in the
Right.
trials you might have to go to the sessions on the schedule of the trial.
Sure. Right. Which may not align with what you personally want.
Right.
Yeah.
Where she envisions, and she did it under the not in a trial, but it was for her. It was like once every 3 months, because once she could bring up something to talk about, then she didn't need it.
Right. Then it was, yeah, now I can think through it myself and be able to talk about it. Yeah.
Exactly.
Yeah. But it is, I think there's so many people who have been socialized or trained to stuff all those negative things down and to pretend like they're not there, to ignore them. And to the point that for many, they need that assistance to get it back out. And maybe that is drug assisted. Maybe it's a traditional talk therapy, but finding a way to access those negative emotions and actually process them. And they may be decades old, but it's there, you know. And so for me, I think it's fun that I get to just use sport to teach that skill, you know, like helping that your average high school athlete who is having a really rough day. It's like, you can still learn to manage those rough days, right? Balance those emotions. How do I intentionally cope with this and not just scroll social media all night? Like, how do I learn to help? And yeah, it's just having strategies that maybe if you have them on the smaller things, when, you know, coach yelled at you today, and it's not a big deal in the grand scheme of life, but it's a big deal to that 15-year-old, and learning how to handle it so that we have adults who are better at being resilient. That's the big picture goal. Sport is just my vehicle with which to teach the skills.
Sounds like it. Okay, so maybe one more thing, and I keep on changing my mind about what the one more thing is going to be, but
It's okay.
But a lot of people, trying to think of a universal lesson to end on here, have trouble sort of getting started. There's so much depression. There's so much. How do I get started exercising again? How do I get started losing weight again? I need to lose weight? How do I start eating healthier again? I was going to ask sort of about the performance mindset, but we sort of talked about that in many parts throughout. But how do you, or what are some words, some recommendations, some wisdom for people who can't seem to get started on something that they have as a goal?
Sure. There's a few different philosophies to this that to kind of depend on the person, but I think my go-to start is action. And I think people want to talk themselves into something, and we're not very good at that. Like, you can talk yourselves out of something just as easy. So that motivation to do something is an action, and it's usually just the smallest thing. If you do a little bit, you'll keep going, right? Like, okay, I don't want to go run a mile, but I can go take a walk and just see how I feel, right? And just that that first action starts the snowball, right? It starts that ability to say, okay, this does feel good. Or like, oh, okay, yeah, I only went on a walk, but I do actually feel better. Like, being outside felt nice. Okay, maybe tomorrow I'll jog just a little bit and we'll see how that, like, it's just that first initial action. And in some approaches, it's called like value-based action, of like taking an action that is rooted in your values that you truly care about.
Ooh,
and I think that's what connects to the goal piece, is like, I can't just take an action on something that I don't actually, doesn't mean anything to me, or because some expert told me I was supposed to want to, or my parent wants me to. It's like, I have to care about it. And so I start with action. But for some people, that is like, it starts with the value of, you have to know what you truly care about. And then every day it's a small action towards those values. Every action we do is a choice. It can move you towards something you love and want to do and want who you want to be, or it can pull you away from that. And so it's just intentionally making those choices towards value-based activities. But to me, that also just means one action. Just take a step forward.
Wow, that was amazing.
Oh, thanks.
Perfect. So, do you have any other closing statements for us?
I think I'll just circle back to that sense that positive psychology is available to everyone, and you can take control of your mindset. If it's something that you want to learn about, go look into it. I wish I knew what that was when I was a lot younger. I found it much later in life, and it's been such a wonderful field to be a part of. So if you want to learn and control, take more control, and feel more confident, look into that positive psychology. It's there for everybody.
Okay, thank you. Before I say goodbye, I'll mention you have a website, www.chelseapierotti.com, and you have
Mm-hmm.
your own podcast there related to dance. I think you're approaching like 200 episodes, something like that.
Yeah, I think 201 just published today. Yeah,
Okay,
so it's passion for dance. So it's really performing arts based,
yeah,
but
and you have courses there as well, and again related to
mhm.
dance, right?
Yeah,
Okay,
absolutely. Yep,
perfect. Okay. Well, thank you for joining me today.
of course. Thank you so much for having me. It was fun.
Cheers.
Bye.